Okay, I'm between you and lunch, but it'll only take 10 minutes or so. I'm Dave Kindig, Emeritus Professor of Population Health Sciences at the University of Wisconsin. As a member of both the Roundtable and the IAPHS Board of Directors, it's my pleasure and privilege to make some closing comments at the end of this wonderful day. Both of these organizations have missions that strongly support the science and practice of population health policy, and I'm hopeful that many more such successful collaborations will take place in the future. I first want to thank again the many people that were responsible for this effort, beginning with the amazing group of presenters we heard today. It would also not have happened without the Joint Planning Committee made up of Bob Hummer, Sandy Magnan, Allison Ayo, Paula Lance, and Lourdes Rodriguez, IAPHS staff, Chris Bacharach and Sue Bevan, the Roundtable staff, Alina Bachu, Carla Alvarado, and Kamani Hamilton-Ray, with additional support from Hope Hare and from AV and other administrative staff here at this beautiful NAS building. Let's give them another round of applause for all these efforts. In my few minutes, it would not be possible to summarize or carefully reflect on all the wisdom and challenges that we've heard today, but I'm looking forward to doing that with all of you over the next few days of the IAPHS meeting. I will, alternatively, take advantage of my emeritus role and highlight what I think is the primary challenge for this field going forward. This book is now more than 20 years old, and inside the front cover, the message inside the front cover is still relevant. Population health improvement, oops, this is out of order. Population health improvement, let me back up here, sorry. Population health improvement will not be achieved until appropriate financial incentives are aligned for this outcome. I could stop right now. Indeed, I actually laid out a very ambitious timeline for research, debate, and implementation in several phases. Some has been accomplished, such as the wide recognition of the social determinants of health and the important health goal of health equity, but as we heard today, much more remains. Of course, financial incentives are not the only thing needed. This slide shows the drivers of the Roundtable work, including goals and metrics, yes, resources, but science-informed interventions, policies, communication and movement building, and partnerships. All those are needed to make this complex, as Josh says, this complex system work. In 2006, I wrote that the population health question is, and I still believe it is, in a resource-limited world, what is the optimal national and local per capita investment and policy strength across sectors, healthcare, public health, health behaviors, social factors, physical environment, for improving overall health and reducing disparities. There's what I said before, I was out of place. We do not know today, to the point of the last panel, we do not know today what the total health budget needs to be. It's not the number that comes from the Office of the Actuary, which reports on healthcare and the governmental part of public health. It needs to include adequate resources for public health, the appropriate amount, but less, healthcare spending, plus that share of other sector investments that are health promoting, such as education, housing, economic development, etc. I've always wanted to estimate what that budget was, and there's all kinds of challenges for doing it, but it's a challenge out there, in terms of we need to know what we need in that budget so we can move forward. The Roundtable mission states that population health improvement, including equity, will require more robust national and community-based actions and dependable resources to achieve it. There's nothing wrong with grants. I've had a successful career on grants, but we need to move beyond grants and short-term appropriations. We need to move to dependable formula sources like crop subsidies, like mortgage interest deductions, or like Medicare medical education payments. Every day, $1 or $10 or $1,000 goes into the pot. We know how to do it. And for those resources in other sectors, like early childhood support and economic development and housing, as we've heard, we need to add our political clout to their efforts for win-win opportunities. I have recently challenged us to move from determinant benchmarks like smoking or poverty rates to investment benchmarks like how much per capita investment is needed to move the determinant benchmarks, with allowance for proportionate universalism to address the extra challenges for equity in the most vulnerable populations. But this is only the view of one emeritus professor. Other views are certainly held by this group. That's why, for the rest of the meeting, we've designed an electronic survey for you to respond to between now and tomorrow night at 5 o'clock. There's a little green sheet at all the registration areas that you should pick up, because it gives the website it's IPHS.org, population-health-survey. Between now and 5 o'clock, it only has 3 questions about your future population health and research priorities, and should only take 2 to 3 minutes to complete. Somehow or other, we will summarize those results on Thursday night, and Roundtable and IAPHS leadership, Josh and Sandy and Bruce Link and Anna, will respond to them in a workshop at 10:45 on Friday morning. So I'd like to close with a few lines from Elliot Richardson's 1996 book, Reflections of a Radical Moderate. He's a personal hero. Actually, my first job setting up the National Service Corps was when he was Secretary of HEW. He's a personal hero who resigned as Attorney General during the Watergate crisis. But in this quote, he's remembering his time as Secretary of Health, Education, and Welfare. This is a quote in this book. Though varying in language and emphasis, his senior staff responses came down to this: it's too hard to measure and do the things you're talking about. Now, back to his book. Each time they said this, I would reply, I know it's hard, but it doesn't mean it's impossible. If it's also important, why don't we get started? He says, we didn't get started then, and the task is even more important now, so why don't we get started now? Thank you. So that adjourns this joint session of the two organizations, and The next session, concurrent sessions, will begin at 2:30 with finding lunch in the various places we've identified. Thank you very much for your attention.